Welcome to another episode of Advocacy at Work. I am your host, Tim McDonald, and today my very special guest is David Russo with Cheeky Charity. How you doing, David?
Hey, doing well. Thanks for letting me be here.
No, I'm so glad you were able to join us today. Can't wait to dive in here. But before we get too far into anything, why don't you just tell us a little bit about Cheeky Charity and a little bit about yourself and what drove you to start it?
Yeah, no. So again, I'm David Russo, the executive director of Cheeky Charity. We're a 501c3 nonprofit that's providing colorectal and anal cancer advocacy with a focus on the LGBTQ plus community. By advocacy, I generally split that into two different sections. One section is awareness, where we try to provide, just understand, try to educate people, the general public, about the needs for both prevention, screening, and early detection of these cancers, and support services for patients, survivors, and their caregivers. It started about 5 years ago in 2021. Before I was established as a nonprofit, I did some research and was seeing that colorectal cancer in particular is, at the time, and it still is, the second deadliest cancer for all people in the US. And there were some new reports that had come out at the time, specifically one from Yale University, showing that there's a trend of it getting worse in young adults. And when I saw that, it kind of triggered me that about 5 or 6 years before then, I had symptoms of colorectal cancer, and I had to fight with my primary care for a colonoscopy. And after a few months, I was able to get it, and they found precancerous polyps that I was extremely fortunate that were taken out before they turned into cancer. I called home to tell my parents, and they were like, "Oh yeah, your grandfather died of colorectal cancer, and the two cousins that I knew had passed away was from colorectal cancer." But nobody in my family talked about it because of the stigma. They didn't want to say what it was. And my dad's been getting polyps removed since he was in his 40s because of his dad's diagnosis. But because my dad never got diagnosed with cancer, I never thought of it as like something that was directly related to me. And so that all kind of culminated into being like, okay, I have this connection to it. It's really bad. There's signs that it might be getting worse. What can I do about it? And at the time, I was actually doing like a COVID eat, pray, love experience where I converted a Sprinter van into an RV, and I was traveling around the country going to national parks. So I was basically by myself in the woods in a Sprinter van. And I was like, well, what resources do I have available to me? And I had the ability to take photos, and I had social media. So I started an Instagram profile, and I called it Cheeky Charity. And the premise was basically that I post cheeky photos with some sort of PSA or something relating to getting people to learn about colorectal cancer. And it was for not having too much TMI, I would do it at different levels of cheekiness. So at the most extreme, I would go into like the most beautiful areas of national parks, and I would more or less take like butt pics. So I would do like beautiful landscape photographs, and then have basically my backside out in whatever creative way that I could. And my goal was really gain as much of a following as I can. So kind of post these and get as many people to see it and to start following me, and to like just be an audience to listen, and then tie in a lot more content. And so I kind of learned about social media and getting followers, and how do you like court people and figure out other people that are in a similar space to collaborate on posts. And that was an interesting experience in itself. And we grew relatively quickly. And after we got to about 5,000 followers, within a few months, maybe a year, I was like, okay, this is interesting. It's kind of doing well. How do I expand on that? And so I realized that it would be better to have other people participate, both from a perspective of sharing more different body types and getting more people to leverage their networks to get the information out. So I started a cheeky challenge where I asked people to post on social media And that did really well. And it kind of just snowballed, like the opportunities where through that engagement experience, we were able to leverage that to connect with the Prevent Cancer Foundation and get our first grant. And then we started doing local work, and fast forward 3 years later, and we've become a pretty well-established national organization.
Yeah, no, that's it's fascinating to hear how it started. And it brings me back to just thinking when you're telling your story, David, about how so many people have something happen to them and just don't do anything with it. And you actually took it as a call to action. And look what it's turned into already.
No, it's been wonderful. I think it's a culmination of being like the right place at the right time with the right external environment. All of those pieces just kind of like the universe aligned to enable that to happen. And I feel fortunate for it.
Yeah. So I know you mentioned, you basically were doing this as a one-man show when you first got started. As you've evolved and kind of, through that challenge that you put out there, the Cheeky Challenge, how and when did you start like looking at bringing in people to, advocates to kind of help you drive your mission even forward and continue to grow what you guys are doing at Cheeky Charity?
Yeah, I mean, there was a few different levels of that. Once I started thinking about this kind of cheeky challenge, I reached out to just my network of friends to see if there's anybody that was interested in helping. And I had some of the most incredible people in the world come on to help me. They weren't necessarily people that had a connection to colorectal cancer. They were just people that were passionate. So I have a friend, Taylor. She works for Google and does graphic design. And I asked her about a logo. And so she put together this most amazing logo, which, a small side note, at the time she sent it to me, and the first instinct I had was like, this is so basic. Like, this must not have taken any time to put together. Like, it just seems too basic. And I pushed back, and Taylor was like, no, trust me, this is good. And it's turned out to be one of the best things that could have happened for us. And then people like Jack, who helped us with the graphic design work and really put a tremendous amount of effort into building out the foundation for us for enhanced social media and for more graphic design. And there's a handful of other folks that were just pivotal. And then in terms of like the colorectal cancer advocacy world, my first connection was actually at the ACS NCCRT. It's American Cancer Society's National Colorectal Cancer Roundtable, where I found a way to get a ticket to it. And oh no, you know what it was? The Prevent Cancer Foundation, we got a grant to do local work in Palm Springs. And then it's Erica Childs Warner, who was going to NCCRT. And through discussion with her, we kind of had this idea of having us come in and be part of a panel during a breakout session. So she helped foster getting us to share our Cheeky Charity story at the NCCRT. So I went, and I had not conversed with any other advocacy organizations. I kind of was this was evolving very slowly. And we were doing outreach to the general public. And we didn't have any resources for people in the colorectal cancer community. And so I came into it as this outsider that was basically taking butt pics and posting them on social media. And so I was so scared going into that environment to be what are these other organizations going to think? They're just going to write me off. They don't know anything about my history or my background. I've got a very professional background in the corporate world, but they're kind of just seeing this random kid who's posting wacky stuff. And long story short, I was completely embraced. Everybody was incredibly wonderful. They were excited. They were happy to see somebody else that was passionate. And from my perspective, I was like a kid in a candy shop. I was like, oh my God, you guys are doing this and y'all are doing that. And there's all these different programs and there's amazing people doing amazing things. And I was like, wow, this is unbelievable. the amount of passion and energy and dedication and work that's going into both, raising awareness and supporting our community is just tremendous. And those relationships have basically been fostered over the last 3 or 4 years now.
Yeah, and one thing I'd love to kind of hear from you too is because if people don't know, I've had the pleasure of being at several events with you and seeing you in action, and just online seeing how many other people, like when you have events across the country, are representing Cheeky Charity on your behalf. And so I would call all those people advocates. And how do you how did you kind of get that ball rolling? And the second part of that is like, how do you really think about strategically, getting that evolved, or is it evolved already for you, and measuring the impact that has for your organization?
Yeah, no, you're kind of pinpointing something that even an hour before this recording, I was just hashing out and kind of assessing and I've been realizing that we don't do a good job of empowering other ambassadors. And I feel like I could do a much better job of making people feel more connected. I feel like I've been fortunate that the framework around Cheeky Charity, where we have the branding and the cute logo, and we develop pins and stickers and a lot of ancillary things around this kind of brand. Thanks to, again, people that have supported me. And a lot is Andrew Wortman, who's our director of development and graphic designer and website developer and everything else, has created this kind of bundle of stuff. And then the main initiative is our Pride events. So we try to have these 10 by 10 booths at Pride festivals. And that's where volunteers and other people in the community have really stepped in to do a tremendous job at showing up and supporting and representing Cheeky Charity. I remember the first time that there was a group of people, I forget what city it was in, that they were doing a Pride that I wasn't at. So they put the 10 by 10 tent up and put the backdrop and the table and I saw pictures of other people doing having a Cheeky Charity booth and leveraging what we created to make an impact in their community. And that was one of the most amazing feelings that I feel like I might have ever had in my life. It's just wow, this thing that was nothing, that kind of went from being an idea into reality, is now being amplified through people that are also passionate and that are just doing a tremendous job. And honestly, in a lot of ways, are doing a better job than I was. And so I've learned so much from what other people have been doing. But there's no formal, we honestly don't really have a formal system for helping empower and onboard and educate and making people feel like they're part of the Cheeky Charity community, even though I know of hundreds of people who are, and I'm super excited about it. I want to be better at supporting you and giving you more resources and more love.
Well, I think everybody that knows you, David, feels the love that you give. So I don't think that's a problem. But I definitely can see, and you're still very young, and obviously your organization. So I mean, you got, I wouldn't get too hard on yourself for not having it all developed yet. But I'm sure there'll be plenty of opportunities, but it's always interesting. I love, this is what I love is doing this, is because I get to see people who have been well established, big budgets and doing stuff. And then I get to see organizations like Cheeky Charity who are really just in the infancy of getting going, and it's always, I mean, it's fascinating to me because, one, as somebody who is in the advocacy world, I love seeing the differences, but also some of the things that you can probably share with some of the more established ones, and some of the more established ones can actually share some stuff with you, and each of you have something to learn from, and all of us have something to learn from. So I don't think there's a right or wrong here. It's just exploring where we're at and what we're looking at doing. What would you say it has been, kind of the direction that you kind of, I know you're mentioning, you were talking to like just about an hour before about like where what kind of vision do you see where your kind of next step is going to take you and with working with all these advocates or ambassadors, as you call them?
Yeah, my goal is to empower and like provide resources to people to share. My ultimate goal is to get the message out, to get as many people screened as possible, and figuring out the best ways that we could do that aligns with our mission. So we have a program that we just really launched more or less in the last couple of months called Butts and Badges, where we ask healthcare providers to wear our little cheeky pin on their next to their badge to start a conversation with patients throughout their time in the clinic, and hopefully it'll start up the conversations and get more people screened because there's more conversations happening. We just sent out like 15,000 of those pins to healthcare providers across the country. And so I'm like the vision that I'm kind of seeing right now, and it'd be interesting to come back on and talk to you a year from now and see where things go. But is how do we learn from that? How do we see what worked well and what can be done better? And how do we create like an enhanced version that can be amplified and have 10x the participants of that kind of program. But the other thing that gets into what you're saying is like the Butts and Badges program implies that that's a person wearing a badge, but I think there's opportunity to basically empower anybody, like any individual who's out there, to kind of wear our pin or share our logo or share our message, and they can kind of become, the term that I'm currently tossing around is a cheeky champion. And so how do we kind of create cheeky champions around the country, around the world, to just feel, again, empowered to be a public health advocate? And it's just by wearing a pin or striking up a conversation could make an impact and save somebody's life.
Yeah, you already got my head spinning that I'm going to have to share some things with you after we're off the recording.
Sounds good.
So let's take a break from talking advocacy for a minute here. And I just have a couple questions that are just not related to what we just talked about at all, just more about you. And they're meant to be really quick. So just first thing that kind of pops off top of your head. So if you're ready, we can get going.
Well, yeah, I just want to say one last thing that just has resonated, that is also equally, if not more important, is collaborations. And I really wanted to emphasize that one of the big things that I'm trying to focus on is building very, very strong collaborative relationships with all of the other organizations that are in the space. I feel like that's so critical. And that would take the top priority for me in terms of things that I feel like are going to be the most impactful, both getting people that I engage with to their resources and just collaboratively compounding each other's initiatives to work as best as possible. So collaboration, I'm just gonna leave that there. And very excited to get into so let's move on. Pop them away.
Okay, if you're ready, first question is pretty easy. What's your favorite color?
Ooh, it like constantly switches between blue and like a maroon or like a burgundy, depending on how I'm feeling when I wake up in the morning.
I love it. And what is your favorite band or musician?
Ooh, it is so vast. My favorite, I can't. Generically, throughout most of my life, I would say like the old school '90s alternative rock, like Weezer. That kind of always is going to be a grounding, kind of like cathartic sound in my ear. But lately, I've been getting a lot more into like playa house music, more like electronic, but like low tempo, something that you can kind of like escape reality in a way. And it's been a nice kind of meditative yeah, like background in my life lately.
Nice. And what is one place that you've wanted to visit but never have?
Ooh, um, well, this is a kind of a cool opportunity to say this. I've never experienced Australia. That's been really high up on my list, and I actually have plans to go at the end of the year to go to a International Anal Neoplasia Society conference in Sydney. So, and what there's a follow up. There's a second part to that.
Nope, that was it. That was the
Oh,
question.
okay.
So,
Favorite
no,
place? Yeah,
that's great. So you have a
yeah,
place you've always wanted to bend, and you're actually going to see it come to fruition later this year.
yeah, yeah. I'm pumped.
That's great.
My partner got me a yeah, encouraged me to go. He's an Australian citizen, so
Oh, nice.
um, he's gonna get to show me around a bit, and so I'll take some time off after the conference.
That's
Yeah.
my favorite way to see places is going with somebody who's from that area.
Mhm.
So-
Yeah. I'm curious if you don't mind me asking, what about you? What's a place for yourself?
Oh, that's an interesting one. I mean, I've been to most places, but I really think that I would be fascinated going to Asia. I don't really have a strong sense of where in Asia, I mean, but I just think it's so different. And I just would love to immerse myself in that culture for a little bit.
I love it. That's
uh,
awesome.
yeah. And last question here is what is one thing that most people don't know about you?
Uh, oh my gosh, you go down so many different rabbit holes. I might take the easy answer, but like, and maybe this is obvious to people. I don't know, but an incredible, I'm an incredibly large introvert. Like I don't, uh, being in crowds is very draining to me, and I'm constantly pushing myself to put myself out there, and I kind of create environments. Like in college, I was an RA in Res Life because taking that leadership role kind of forced me to engage with other college kids, and I joined the ambulance corps to like engage with people, and I took my MBA to learn how to be a better communicator when my background was in engineering. And so I've kind of always been doing these things. It's kind of like masochistic um, things to kind of torture myself. But I absolutely love it. And but yeah, being an introvert.
Okay. No, and I was just kind of laughing when you first said it because I'm like, every time I see you, it's in the big crowds of people. So.
Yeah, I'm glad you can't like my thoughts don't get expressed as like some sort of like bubble around me. Otherwise, like I feel like the room would just implode. Um, but but yeah, it's I mean I'm so grateful for pushing myself because I've met such unbelievable people, and it's expanded the quality of my life exponentially. Um, so I mean, people like you, meeting at Colorectal Classic, what was it, 3 years ago, was so wonderful, and to see the fostering of the relationship from then to now, and just to see all the things that you've been doing has been so wonderful, and um, so yeah, I'm so happy.
Yeah. And my last question for the podcast is this is if there was one big thing you could do with Cheeky Charity, if resources were no issue, what would you want to
Mhm.
do?
Oh my gosh. um, I I would want to get I would want to get a lot of like celebrities on board with the campaign. I I'm gonna like just be organic and put this out there. But no, I would love to do a campaign with like a large group of celebrities around like the cheekiness. And there's a so this is pretty wild. So ESPN had a magazine called ESPN Bodies, and it was basically like once a year issue where they did nude photography of athletes, the top athletes in the world, from Serena Williams and Michael Phelps and Rob Gronkowski, and just thousands of people. And I thought it was an incredible like visual of like the work that people put into their bodies to become professional or Olympic athletes. And I was like, I wanted to do those kinds of shoots, but for colorectal and anal cancer awareness, and really do like a professional, like large scale job. And I would turn it into a museum exhibit, where we would have like a rotating exhibit that can go to like all the top museums in the world. And it would be either the photographer or the model or somebody in the realm of the experience has a story relating to these cancers. And so in the museum exhibit, there would be like the finished photographs, and there could be video behind the scenes, setting everything up, and then audio of the people's stories. So as people are kind of walking around the exhibit, they're hearing the message of people's stories and feeling that impact and feeling that sense of need to, so just like to listen. This has been in my head for years and I want it so badly, but it's basically, like you said, it's like a pipe dream that is on the shelf that every once in a while I'll be like, is this feasible? No. Okay, let's keep going.
Well, do you have like one of these celebrities in particular that you'd really love to see do this, and we can mention them in the in the podcast?
I mean, it might be better that I mean, there's probably people can probably infer who it might be, but no, I want a diverse set of people, and I think like I want, yeah, I would love just a diverse collection of folks. Anybody that is willing to put themselves out there. And the premise of it is like vulnerability. That's like the high level concept is vulnerability and being vulnerable to show parts of you that are difficult and to let other people see your vulnerabilities. But yeah, I'll defer. I'll be a political and deflect. There you go.
Well, David, thank you so much for joining me on Advocacy at Work. And where can people learn more about Cheeky Charity and the work that you guys are doing?
Yeah, please go to cheekycharity.org. You can look us up on social media, mostly Instagram, at Cheeky Charity. And we have a new page called screenyourbutt.org that we're trying to push as part of our campaign. So yeah, those are the channels.
Fantastic. Well, thank you so much for joining me, David. And if you're listening, check out advocacyatwork.com for other episodes of Advocacy at Work. And don't forget to visit Amazon and look for From Patient to Advocate, my new book that's out. And we can't wait to see you next week.
Thanks, Tim.